Well, good afternoon, folks. We're just, Des and I are just trying to figure out the presentation technology here. Des, is this the first slide?
It is indeed, yes.
Excellent. There we go. What we're going to do in this session is that we've got roughly 20 minutes for question and answers, if you have, because we're aware that Des and I presented quite a lot of information at you. So if you have questions that you want to ask about the approach, either questions about the ideas or questions about how that's implemented in practice, then feel free. This is an opportunity for 20 minutes to ask those, and then Des will take you through a more detailed exploration of how some of the ideas that we talked about might be implemented by commissioners. So if anyone has questions to ask, then now is a great time to do it. You can either do that by writing your questions in the chat, or by kind of raising your hand, and we'll see whether you can actually speak to the whole group. So if you would, if you have a question to ask, either to write it into the chat now, or raise your hand, and we'll you can speak it out loud.
Can I just check that everybody? Oh, Andrew, on you go.
Oh, you're on mute, Andrew.
You think after 2.5 years, wouldn't you? It's been a hard
Hand
week.
in the jar, yes.
I guess this is just a practical question about how it happens in practice. When you're having those conversations at the early stages and looking in the learning cycles, particularly I'm guessing maybe at the people and the kind of team level, do questions arise about who should be doing the work? Because it seems to me there's quite a fundamental question that if the learning's smart and it's done correctly, it would tell us, and I'm biased here, so I look after a community programme, eight projects in Scotland, but it would seem to me, and I'm biased a little bit, that actually sometimes community workers, if they're given the right skills and the right thing, they can achieve an awful lot of the outcomes that the whole system, we seem to think, needs to do it. And I just would think, you know, that seems a little bit further down, but I think it's an important question. I wonder if it ever comes up in the learning environments.
Thank you, Andrew. And because there's not many of us, would you mind, I think we have the opportunity to get to know each other a bit. So do you mind saying where you're from, what your context is, just to help people understand?
Sorry, I work for a Scottish charity, Inspiring Scotland, and I lead a national community development programme called Link Up. So we work in 8 communities across Scotland. One of them is actually Muirhouse in North Edinburgh, and I know you're working there with the Nessie programme as part of that bit. Our Link Up project's part of North Edinburgh Arts. So it's that and some of the other projects where we've increasingly been looking to human learning systems, because part of the evolution of Link Up is about how we connect the community level, what we've done with the public sector system, because we can see there's opportunities to do that. But this is a question that's puzzled me a little bit. We always seem to frame things in the whole system. I'm thinking, well, actually, who does the work can be just as an important learning point.
I'm happy to respond initially to that, Des. You will have see that Des and I now sat next to each other. So so I suppose I would answer that with some examples for how people in practice have answered that question in different places. So in Gateshead, for example, where they've been kind of exploring this approach, they've adopted a kind of they've found a similar answer to that question that I think you were alluding to, Andrew, that essentially the person with the first relationship with resident citizen, however you want to kind of frame people's involvement, can work with that person to solve, I think their figures say something like 80% of the problems that people have, because what they found is that most people's problems don't require really highly specialist professional help, that most people's problems can be addressed by an effective relationship and enabling people to work together more effectively. So there are some things that require the input of a housing officer. There are some things that require the input of someone who can work the benefits system, right? So one of the things they found in Gateshead was that all the cohort of people they worked with, every single one of them's benefits were wrong. And that requires special, like, work with a benefits advisor, so someone who can actually access DWP's computer and like put in and work to get a claim that's actually right for people. But what they did in those circumstances was that they pulled that specialism into the relationship that the initial person had. Right? So they moved away from a model of, oh, if you've got a problem that requires specialist intervention, we will refer you on to that other person. So they stopped doing that. They stopped doing referrals at all. Instead, they talked about how to pull specialists into the relationship that they had with people. So it centers that idea that it is the relationship a worker can have with a person, and say that relationship itself is really important for helping people move on from whatever's difficult in their lives. But if it requires additional specialism, that can be brought to us rather than you having to go on somewhere else. I don't know where. Is that a useful response?
No, that's very useful, and I guess it kind of confirms anecdotally what I thought. And what we've done with the Link Up programme is invest very strongly in equipping our workers to deal with the psychosocial stuff and giving them the skills to engage people in a meaningful way, to sustain the relationships. They're naturally interested in their lives, but it's giving them the skills to maintain that relationship, and that can make transformational shifts happen for them.
Indeed, and that understanding what the patterns are amongst both the strengths and the needs that people have, and then at that kind of place or organizational level, equipping everyone to respond to that. That's another response that we've seen from kind of people working in the human learning systems way. So one of the things that Plymouth did, for example, was when they brought the organizations together to learn, a bunch of one of the things they found was that the people in direct access homeless hostels were saying that all the people that we engage with have significant mental health problems. Can we have a mental health nurse in the to work alongside us in the hostel? And actually, the response from that as a kind of collective set of organizations was quite interesting, because they said, hang on a minute, if everyone you're dealing with has a mental health problem, then all of your workers need to be able to respond to that as a mental health problem.
Agreed.
So they did. So rather than putting specialist mental health nurses in the homeless hostels, they trained all of the direct access hostel workers to be able to offer mental health first aid and blah, 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 blah. So it just that if all of the people you see have a thing, then all of your workers need to be able to respond to that thing.
Self-evident, yeah. Gotcha. Okay, thank you.
And Andrew, I don't know if just from my own point of view as a commissioner, I guess turning that on its head, that one of the pieces of work we're doing just now under the HLI stuff is looking at what they call high resource users. Terrible terminology, again, system language, people who turn up at the front door of emergency departments on a routine basis. And it goes back to a bit of what John said about fixing a broken leg. You may well fix a broken leg, but you send them home, and where are they going back home to? What's their ability to recover, etc.? And that's why I was saying about the community response to that.
Yeah.
So from our point of view, understanding the whole system, the really important part of that is to see everybody's role within that and how they play the part in it. And at the moment, we still have a health and social care system which has a habit of fixing a bit. And of course, that only has a limitation So we have in every area of Scotland, we have small numbers of people who repeatedly come back. Now, the system describes that as being high resource users. They use a disproportionate amount of money and resource. That's how the system describes that. What I would say is that what it really means is the system isn't finding the right answers to that. Why not? And what we're beginning to do by taking an HLS approach is you almost literally follow them home and say, Mrs. Smith, who are you? And what you learn is that those issues are around social isolation, loneliness, poverty, as Toby's talked about in some of those examples, poor housing, you know, all those sorts of things mean that actually they come back time and again. So what you see from a system point of view is the symptoms of all that, and if you're only ever addressing it there, then you're not really getting answers. So the reason, from a commissioning point of view, I think it's really important we have that whole system, is because of that aspect. Does that make sense?
Yeah, that does make sense. This, yeah, thank you.
And sorry, hi, my camera doesn't work. I'm Anna. I work for Community Renewal and for Link Up team as well. So, and first-hand experience, it does work great. It does work when you talk to people and when you listen to people. It really works when you keep yourself informed. So I think my first job is to be everywhere and know everything, what's going on, especially in the area. It's to be part of this conference and listen from the experts what their ideas. And I think it is really, really important for the case workers not to work just like we think, but actually put our work in a perspective and make sure that we understand the reasons behind our actions. Because sometimes, like in our work, when you know, like every day you've got a client and another client and more trauma coming your way, and how do you organize food for this family, you're kind of forgetting about this perspective that this is coming from somewhere, and we are actually very important on the ground for these people. But being part of the bigger discussion, it puts, yeah, as I said, it puts this in a perspective, and it kind of makes us feel important. And I think this is also very, very important for us. So yeah, it does work. So any practical questions, they can come my way as well.
And I think there is a point there about the recognition that that works. It isn't always there. So looking across the whole system, there is, to some extent, an expectation that community just picks these things up. And again, yes, we did see during COVID the extent to which people did just pick things up, but you can't, what we're seeing now, of course, is that whether it be volunteers or paid staff within local organisations, experiencing that same burnout, that same real challenge about being able to keep to going. And unless there's a space to acknowledge that, the risk is that people will burn out, and that's not sustainable. So it's important that we capture the evidence of that and the learning from it. And I suppose that's the thing, is that's not something you performance manage. It is definitely something to learn around. So we don't know if you had anything to say on what Anna was getting back on.
And I suppose what I was interested in asking you a question, Anna. What are you learning from the work that you were doing on the ground? Because as you say, kind of that approach of kind of building relationships with people, and whether that when you say it works, that would fit with the evidence that we've seen as well from across a whole numbers of different places that are trying kind of similar approaches. But what have you learned from that process of building relationships with people and kind of trying to bring those different people and organizations together at the neighborhood level?
So the first, I've learned to listen more, and I've learned to listen the way that I understand what people are talking about. I think this is the beginning of the process. Somebody comes to your door, and as much as I can talk for Scotland, no problem at all. I need to learn how to listen as well, and how to actually hear. And it's like, for me, when I started working, it was COVID, and having telephone appointments, it was the biggest nightmare ever. It's not only the language barriers, it's a lot of things. You don't see people's reactions, and you can't see the body language, because that all together comes to such an important information and builds the picture. So the listening and the process that we use in community renewal, the listening, conversation, and then the holistic approach, really, really important for as a start of the learning. So that was the thing. The other thing what I've learned being here is also that I need to keep myself informed in the top of everything what's going on, not only in the area but at the moment, but also about plans and how is the organization working together with some partners fitting into those plans. Obviously, like, I don't work in Bingham, I work in North Edinburgh in Pennywell office. So it's slightly different, but our area is going to change dramatically over the next few years with massive developments coming our way. So we want our community to be part of it. What I've also learned is often for the organizations like Community Renewal and all the charities, the community that we live in is very much kind of one way. We see people that are poor and we see people that are disadvantaged. That is completely not true. The community is full of people that have an amazing ideas. Mm-hmm. The community is full of people that are open-minded. North of Edinburgh, and not only north but south as well. Like, I believe Bingham is full of people coming from different backgrounds, countries, religions, and everything. And because they don't know about the services, about the possibility of using them, we're just not using them. We're just like, they live their own lives and that's it. But if you start talking to people and actually listening, like, so what is really what you're interested in? What is really what you want to do? And you may find out amazing things. And being able to connect easily with organizations around, I think I find out this very useful. So I think that's why I work in 2 jobs now. First of all, it works great. You can send an affair across. You don't need to refer. You can just have a chat with people and find out about lots of things. So not making everything very official. I need to see you on Tuesday at 7:15. It doesn't work this way. People are coming to pantry. People are coming for a chat in our office in Linka. People are coming to community meals. And this is the time to talk to them. Not an unofficial meetings with passports, with GDPR sign up. This is like really, really a massive barrier. So that's another learning. I've learned a lot here.
Amazing, sure. Thank you. Are there any other kind of questions that people wanted to ask in respect of any of the things that that Des and I were sharing? If not, I have another question that I want to ask the 2 of you.
To be honest, I don't have a question. I would rather listen more from Des and from yourself about the theories. That's the main.
Okay, thank you. You will hear more from Des in just a minute. Just before we get into that, was there anything else that anyone wanted to ask about any of the stuff that we've shared so far? And then we will likely have time for more, because Des is going to go into another layer of kind of detail now, and so I think there'll be opportunities at the end for further questions if that raises thoughts for you. Okay, Des, I suggest that you go with your next presentation.
And my lovely assistant Toby is hopefully going to share screen, because I am struggling to do that at the moment. Technology is not working for me there. I mean, in some respects, because it's a small group, I think we might kind of come back to this screen more often, because it's nice. And sorry, Anna, that we're not able to see you as well, but I know that technology isn't always, it's getting there, but it's not always hugely reliable. So what we wanted to do was to go through a learning cycle and to think about how might you, and I guess, Andrew, with maybe even some of how you're intending to, given you've got a link into the Nessie project there. It'd be interesting to hear some of your thoughts on that. So what we want to go through is a learning cycle, thinking about things like who needs to be involved, what is it you need to do, and therefore just thinking, I don't know if we can go to the first slide. Oh, yep. So going through this cycle and thinking about, we will kind of think about it at place level, but I'm taking the point that you both made about absolutely start at the right place. And one of the things about using this approach is to start at the cycle that the most obvious question lies. So it may start at person level. What difference does this make for individuals, people? It may well start an organization saying we're not reaching a certain group, or so there's a question that's posed, I guess, within that, and that's then sorry, that's going through the whole screen. Thank you very much. So those questions, that cycle applies at each level, and I think one of my learning points when I was kind of first becoming familiar with this was the connection between, as Toby talked about, that when you're learning from individuals, it becomes really alive as how, therefore, what does that mean for either the next level up, or in one of the examples from down, I think, kind of south of England, was actually the question posed at place level, and then we'll only know this if we push down the way and ask some questions of people who are living in the system. So we're going to try and go through this and just kind of get some time. If you've got a bit of pen and paper next to you, then it allows you just to capture and think about, if you're starting your own experiment in HLS, what is it you need to do that? So if we start with the next slide, which is what's the purpose? So thinking about that, so for example, and this is based on Edinburgh, we want people who misuse alcohol in Edinburgh to lead thriving lives. So even in the language of that, you can see that it's not language about saying, how do we address, people when they've got alcohol misuse problems when they come in, but actually that much more aspirational. This is about how they lead thriving lives. And I don't know if there's anybody from the work that you've got at the moment that you're involved in. What sort of purpose how would you articulate purpose there? Andrew, is that something that's come up in the NESI stuff already, or the work that you're related to that?
Thanks, Des. I should add that Anna's going to be part of NESI as well.
All right. So, we can both, I mean, in some ways, Susan, I'm mindful you're also on the call.
Yeah. Sorry, Susan, you're getting dominated by this thing in Edinburgh.
And we did not plan this. That just happened.
No, we didn't. Just by chance. We were actually talking tomorrow, Anne and I, about how we're going to support this. So I'm quite at an early stage with this, Des, even in my understanding human learning systems. But my understanding from speaking to the chief executives that are taking the NESI program forward is that there is an opportunity there through enhanced support to improve the quality of life that people are struggling the most. So for me, the purpose, and this would be me in my words, not necessarily what the leaders of the program were saying, is that it is not just to help people through a point of crisis, but actually to help people to live better lives long term.
Okay, and that feels like a good starting point. It's that kind of big question, and it's focused on the difference that it makes. And so what we're therefore going to do is break that down. And I don't know, and Susan, by all means, if this is helpful going through it as an example within Edinburgh, and there's learning there, but if there are from your own experience, Susan, are you on the call still? Just checking. Not able, either that or no, maybe not able to come in, Susan. So I hope this still helps, Susan, in a way. But Susan, if you do want to come in later, please do. So if we think of that as a purpose, the improving life. So the understanding system then. So where we start on this, and maybe this will be useful in terms of just the place you're at. So thinking of that slide that Toby put up about the actors and factors, who are the actors that could help make that happen? And obviously you both already kind of indicated that grassroots, but who across the different, thinking about some of the different levels as well, who are the actors that come to mind that would be involved in this?
Anna, do you want to answer that one?
I believe that all the actors that are the organizations that we work with, the NESI is for different organizations, and we're completely different in our approach, but we do have the one kind of like agenda to do it. There's lots of different organizations that can come across and help. NHS, Citizen Advice Bureau, and everybody who's in the area will definitely be the people that are needed to make this happen.
And in terms of the community themselves, you know, what sort of, how big is that? What's the makeup of that community then? And is it deprived areas? You know, those sorts of things. Who are the actors in that respect at person level?
Yes, where we are based, it is at the private areas. However, as I mentioned, like I believe we don't want to look at our communities from the perspective, oh, we are so good and we need to help you. That is totally not true. I believe that most of the answers that are needed for us is in the community. We only need to find the people that are brave enough to step up and say something, or from the volunteers that are already with us and the new ones that we can bring together. But yeah, it's really diverse community where we are. There are new builds, old buildings. There's like yeah, all sorts of different groups that are kind of organically created. There's a quite big Polish population. There is also African population here, Spanish. So
so that thing
very
about
diverse, very diverse.
and the thing about equality and equity will come up there in terms of how you reach. I guess it depends the degree to which that ethnicity kind of plays through in terms of how close those communities are within themselves, how all of that sort of stuff. So there'll be quite a bit to kind of think in there. And thinking back to what John talked about, knocking on people's doors, I suppose there's that part as well, but how do you reach some of those actors in there, especially if this is about that big aspiration of improved lives, those who we often describe as difficult to reach. I think if it turned it into the system, it's like the system finds it difficult to reach them, but they are there. Is that sort of in the conversation already?
I don't know if it's hasn't really started really yet. However, what I know from, like, I live in Edinburgh 18 years, and the last 13 years very close to Pennywell and the area here, and I know lots of people here, and I know this community. I used to live on Pennywell Road as well years ago, so it's really familiar to me. So and through working in the community for the last 1.5 years, also is fact that reaching people it's really difficult. Door knocking is a great idea. It's really good, and it may work for a lot of people, but for lots of people, we do have people coming from countries where knocking to the door means you're in trouble. They're really going through trauma. We really need to be very careful of what we're doing and how we're approaching them. Knocking to the door of a person who's been through hell at home and that's been through things that we can't even imagine is the worst approach ever. There's another also story of language barriers, that people that don't understand what you want from them, they'll be scared if somebody knocking to the door to them. On the other hand, there services that UK Edinburgh provides doesn't exist nearly anywhere else in the world. The service, all the support that's available. People just don't go ask about help because they don't know the help is available. So there must be another way that we need to try to reach these people. There is another story of people that are illegally here in the area, and there's lots of them. So they're just scared to go and talk to anybody in case they're going to be deported. So we live in quite complicated settings here, and we really need to be very careful, very careful with who do we knock to the door, and how we do it, the questions and everything that is created by community renewal is great and it works in many cases, but I believe it won't be everywhere.
I think the only thing I would add, and Anna was spot on with so much of that, but one of the things that we've learned from Link Up, because the Muirhouse Link Up is one of 8 we've got in Scotland just now, is that actually the environment and space you create is really important. And workers like Anna and other Link Up workers, actually at their best, they're pastoral in their role. They don't actually know Inspiring Scotland or even Link Up, they know the worker. And that's how close that relationship gets. And what we've found over the years, and very quickly we identified this, as soon as you label your project as about being about anything, people will not come to it. It just won't come. You know, one of the earlier projects, the host for the project was the Scottish Association for Mental Health. And as soon as that logo appeared above our door and on our posters, people went, that's a mental health project. So creating the right environment and space without any agenda, not being about any outcomes, taking time and persevering, going at the pace of people, all of these things are what we've learned over 10 years, and that's kind of central to our way of working. And I said at its best, our workers are almost pastoral in the way that they begin to operate. And I think it's that sustained presence that builds trust and respect, and why people keep coming back and are prepared. Because we know, as you said, Des, the hardest thing for many of those groups that are rarely heard is actually to open that door for the first time. That is the biggest challenge for so many of them. So, you know, that environment, but actually going to people and engaging with them where they are. You know, we've done really innovative things. We had somebody in the early days of Link Up that set up a couch and a table with tea and coffee at a bus stop. Just sat there day after day and speaking to folk, going to hairdressers, because that's a place where everybody talks about everything, and hairdressers know everything about the world. Engaging with dog walkers as well. We'd a worker in, sorry, I'm going on a bit here, but we'd a worker in Postle Park that was engaging with young mums in shops and the hairdressers and other places. And she was here in Postle Park in Glasgow that, you know, none of their children had ever seen the seaside. So she built a beach on a football pitch in the middle of Postle Park. I say bought, I think she stole 20 tons of sand, put paddling pools, beach balls, got the ice cream van to come round. Everybody got a free ice cream. And over that weekend, about 300 or 400 people appeared. When everybody says it will not work, there'll be broken glass, there'll be dog shit, there'll be needles in that bit. But actually she proved that's not, people wanted this, and it stood out, and it was innovative, and it was different, and it was where people were. And on the Monday, there was a picture of 2 kids playing in the sand on the front cover of the local Evening Times in Glasgow. And everybody in Postle Park says we're never in the paper other than for death and drugs and poverty, and we're never on the front page, and we've never got a colour picture. So it's that radical way of just stepping out the box a little bit brings people, but that coupled with that environment is really what I think makes people engage with Link Up. We've learned that over the years.
And so I'm curious to kind of try and like bring together some of the things I think of hearing here, that there's a bunch of the actors who you're trying to engage in a place who will have a strong sense of purpose, right? We are an organization whose job it is to try and help with this thing, the mental health folks or blah, 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 right? And there are a bunch of other actors whose purpose is more kind of like, it's less easy to express in that kind of, we're trying to achieve this, or it's like, we're trying to make this place better.
Yeah.
We're trying to enable people to live the lives they want. Like, do you have what's your experience of bringing together those organizations with a kind of particular thematic purpose with those that are more of a kind of place purpose, and how easy is it to enable those different types of actors to develop a common a language and a common kind of sense of shared purpose around a place?
Yeah.
Can I just come in just 2 seconds? Just I wanted to acknowledge Fiona. Thanks for joining us. Just so that you know what's going on here, we're talking through an example of a learning cycle. We're situating it in Edinburgh at the moment because two of the colleagues that are on at the moment are sharing some of their experience and of that. But please do come in at any point. It's a small group, so don't stand on ceremony. Just more than happy. I can see you on camera, so at the moment, so I can see a hand going up, which is I can't see everybody. But if there's anything, then please do join in. But just so you know where we're at, just
thanks so much. Appreciate that, and sorry to be late on, but better late than never.
No worries at all.
I should confess here that Fiona and I know each other quite well as well.
Yes, it was great to hear you chatting there, Andrew.
So I did hear that everyone in Scotland knows everyone else, right? And now this call is just confirming it.
It's definitely like that. There's no question. So good to see you, Fiona. And if Fiona can talk to this to the cows come home as well. But I'll just talk about some of that your question there, Toby. That is difficult, whether you're a thematic one or just there for the community. And you know, this is well known. People are quite protective of their space, and funding drives that in many respects. So it is challenging. And I think certainly when we started out with Link Up, you know, we went through a local organisation, so there was a presence, there was some trust there, but people are still quite protective of what they have. And I guess what made the biggest difference was our ability to sustain our presence there and be part of the kind of local infrastructure. And that's what changes mindset. You're not a fly-by-night. You're not dropping in there just to try something and get out. We made a commitment to those communities to be there as long as we can possibly be there, hopefully forever. Well, actually, maybe not. That's not the right thing. Hopefully to remove ourselves at some point, but to make that commitment. And I think that began to break down the barriers. And therefore, whether you were a thematic provider or just there for the community, there was an engagement then and talking about the knowledge that they had of families or individuals that we might know, and them saying, well, we can point them to you and we can point you to them. So that takes time to actually do that.
And one of the things that one of the challenges that we've seen from some of the other places that are doing this, for the example in Liverpool City region that I thought was really interesting, is how you build the trust between people who might not initially share a different purpose to develop that sense of shared purpose. And one of the things that we've seen work in other contexts is a process of like really open learning together. So let's put everything that we know on the table. Let's share our experiences. Let's share our knowledge, and collectively we can make sense of what this means. And I wonder if that kind of idea that shared learning together builds trust it resonates with you in your experience.
Definitely. I think Fiona could come in and talk about this as well. I'm conscious that Anna and I are kind of hogging things about, so Fiona, feel free to come in.
Oops, sorry, just say what you were going to say, Andrew, and then I can hobby horse on it, but I know we'll have some shared experiences.
Yeah, Toby, I think that's right. I think there's even a challenge to even get people to come to the table and put everything on it a little bit. Part and parcel, I think, where we've found, particularly with what you might call, you know, public sector or, you know, even Scottish government people, we're part funded by government as well, is that there's a light bulb moment. We found very early. Get those officials, those civil servants, even local ones, get them to come out and see the project, come into the old co-op premises in Pennywell Road, see what's happening there, speak to our Link Up workers, speak to local people, and you can almost see it in their eyes. There's a light bulb moment when things turn on. You know, in the early days, it was all about asset-based work, and that's what we were talking about. And, you know, we were funded by government. We brought government ministers out, we brought civil servants out, and they're saying, yeah. But it was only when they were there on the ground they could hear it, rather than myself as like in this intermediary doing it, that it really became real for them, and the light bulb came on, and that understanding just rose exponentially at that point. And their commitment to what it was about and their commitment to engage with us started to change quite fundamentally. And even in Nessie, you know, that's part and parcel of what needs to be done there. So we've convened and brought 3 parts of the council into the little co-op, and speaking with Biddy about the Nessie approach and how that's going. We're getting some NHS people in now, health and social care partner people in now as well to that space. You know, and we know that's the starting point of actually building them into, you know, our learning cycle and how that's going to work through Nessie as well.
Amazing. Des, I realised that we got deep into a conversation about understanding the system, and there's 4 more stages for you of the learning cycle for you to explore. So do you want to keep going?
Well, I do want to keep going, but what I would say is that in the way that we talked earlier, that nothing is linear. The aim of today is to get started. And I think as long as people are feeling that they begin to get started along that journey, that's a successful outcome for me. So just describe my outcomes from the beginning. It's not that we have to get to the end of these 4 stages. If we do, that's fine. If we don't, then it's because the conversation's there. And I think that's a lesson in the whole way that we work in this kind of field. Is it's not about saying we will follow the process to its T and be on time regardless of the outcome. So I think that the main outcome from here is we have a good conversation. And I'm interested in, particularly before moving on to this slide, is that I think about the role of commissioners in there, because it speaks to what you talked about at the beginning about how much of this sits in community, but there is that role of commissioners. And Andrew, I'm thinking about the role of something like Inspiring Scotland as an organisation who often has that oversight role that feeds into commissioners about. I happen to be chair of an organisation who are funded through the Inspiring Scotland CERD stuff, so I know that kind of stuff about how do you. So I just wonder if you've any thoughts about how you how do you see the role of commissioners in that link into public sector commissioners, or indeed is it all public sector commissioners, or is it some grant funding bodies? Any thoughts on that?
Yeah, I mean, fair enough. I'm not blocking you, so don't worry about it. She's sitting there listening. Yeah, it's an interesting question, Des, and I'm starting to see. I think what might be interesting, I'm starting to see a little bit of a shift. So, in a sense, what drives quite a lot of the work that we've been doing over the 11 years of Link Up has been Scottish Government policy areas and policy teams, and we've been in quite a unique position for the last 8 years, where we're funded with 3 parts of Scottish Government: population health, building safer communities, which is the justice side, and the regeneration side. And they've all had quite different policy agendas, but what's been happening over the last years is a kind of a coming together of them. So at the moment, the population health team in particular have been, looking at how Link Up's experience and its place within these communities can actually take forward their aspirations and their policy objectives, which is one of the critical ones is their community work stream, which is about how do we take community-led responses to inequalities to scale in Scotland. And they're recognising the value of human learning systems as part of making that work. So they're charging us with actually getting engaged locally to facilitate this coming together. And I guess what's probably quite new for us from an Inspiring Scotland perspective is in 3 places we are becoming, I think the term is a system convener. Is that maybe the right kind of way of describing it? Where we're starting to say, look, we've got these relationships. At the moment, nobody's bringing some of these bits together. That's not true in Muirhouse, because Biddy and Kate and the other organisations have done that. But I guess what we're trying to do is to bring some of these parts together with a no more logic than say, if we can make the whole greater than some of the bits here if we think about this carefully. And that's not just about service and responses and improving outcomes for people. It's just how things will actually work in a better way as well. So the government are kind of saying that, but I guess it's also our experience over the last 11 years is telling us that needs to happen. That's the next evolution of Link Up. Link Up has done stuff at an individual level. That's where we started. It's initiated collective action, and we're seeing that started. So the next step is how do we build on that? And therefore the natural thing is how do we bring organisations and other parts of local systems together and make that work in a more effective way? Early days, though, I would say.
I think we are the same but different. We've spent the past 16 years since Centre Stage began back in 2006 in trying to create a balance between place and people, different physical spaces for different people, but connecting them all into our original space, which was a theatre space. So we were always using the arts as a hook to bring people together. And on the journey of building relationships with other people in other communities beyond the original space, you were discovering need, just as Andrew's saying, through the trust and relationships, people would disclose things to you because they didn't know what centre stage actually was. So you didn't feel like a service, and you were able then to not only build relationships and successfully introduce people to the services they needed, but also build relationships with those other organisations who shared that collaborative mindset, who didn't want to protect it wasn't about protecting your funding, it was about knowing what you're there to provide and what are you best at. And whilst the journey of getting to where we are now, which is in the former Kilmarnock Academy building, which is a 1.8 hectare site where it was community asset transfer, we purchased it on behalf of the charity, but that allows us to reset what we are here to provide. We are here to provide a welcome, a lovely place, a place that provides different entry points around the site for different people who are at different places, whether it's social inequalities, whether you're just coming because you want to sing, whether you're coming for a coffee, whether it's a health challenge. But there are different points of entry around the place, and there is what we call the neighbourhood, where other organisations are now based, who share that sense of collaboration, who share the will to work together in a values-based way. And we're very much at the point just now of co-locating. But the vision from January is to start really relentlessly integrating our services and to be able to say this is what we do for the benefit of the people coming through the doors. We do not duplicate, and the intention will not be to duplicate, but will be to truly collaborate and to try and effectively create a health ecosystem within this single space, so that public health can look at this and recognise it as a space where all the things that are required to maintain a sense of well-being are contained within this one physical space, but we are not keeping folks stuck. They progress in their own capabilities, hopefully, but they never need to leave the community, because the music's always here, the place is always here, the arts are always here, and that connection across different types of people is here. So we're very fortunate in that we have a very broad social demographic. We have absolutely everyone of any type is here, but nobody needs to know why you're here. You're just coming to centre stage, and when you're here, you can access the support you need, you can access the opportunity you need, or you can just come and be part of the community. So it's been a very steady 16 years of learning, and Andrew and I's paths have bounced a lot, and Andrew has been a very wise counsel, and we have had it's difficult sometimes, I think, in our sector to trust an awful lot of people, and I trust all the conversations Andrew and I have had, because I think what often happens with the third sector, and particularly people who are in an innovation space, because we have to get scale, we have to share. And you hope that ethically the public sector, when they're learning from you, and they do, will then come and invest in you and help you take it further. Often they don't. And our journey has been that they don't. They will learn from you and they will take from you, not thinking they're doing anything wrong, but they then effectively force you into the duplication space where we're not allowed to be. So you have to go in to innovate in something else. So it's a really delicate dance in our sector, because we are the third sector, and it's a hard place to be, because trying to get across to the wider system, we are working with you. We want to welcome you into our space. We want to say, come and bring the best of you to the place that we now have, which we have. And we are now saying to East Ayrshire in this case, come in, just come in and add value. We don't want to do what you do. We need health, we need social work, we need doctors. You come in here, not trying to keep us at arm's length, as has kind of been the case. We're not trying to get in to the big system. We're saying, come in to us and let's work together in a different way. And then let's see if we can share that with other organisations, with other places. So we're at the start of something that's really quite interesting.
Yeah, it's really helpful, Fiona, and I think that, I mean, I'm familiar with centre stage stuff, and I think it could be a great case study, to be honest with you, because I know I know the background of that. But what you said there about we don't have a wider system that is learning from that. They're observing it,
Yes.
they're seeing it, but there's not learning because there's no system change elsewhere.
No.
And I guess what I'm going to do, I'm mindful of we've only got about 5 minutes. So what I'm going to do is just to give some sense of the rest of the journey of this, what we'll maybe just do is go through the rest of the slides. But what we've seen here is that at the in taking an HLS approach, you need this space, and it's very much about having the space and time at the beginning to really understand. And it's that almost measure twice, cut once sort of thing. So this is the kind of approach that makes sense within HLS. It's taking the time at this point. It's understanding the system. It's not just writing it down and describing it. It's doing what we're doing just now. So hopefully that's a little bit of an example from that. But Toby, I don't know if you want to just kind of go on to the next slide. And apologies, because I feel like I feel like we could have a 2-hour session here. But this speaks to some of what you're talking about there, Fiona, about working with, because actually that co-design is, and I don't know if you're anybody familiar with the participation ladder, called many things, but at the top is that kind of co-production and co-design, and very much recognizing this is not consultation. It's not about saying, okay, we've designed it, but we're looking for consultation. It's that space of absolute as close as possible, absolute parity of input, of respect about roles and remits. And so a lot of what you described there, Fiona, is something that we see time and again, where good things happen, but they happen in a space, they're observed, they're to excuse the expression, given a pat on the back sometimes, you know, clap, whatever, but actually there's no understanding system. So that, from the understanding system, is thinking about, okay, so this now needs to go. So the co-design, so it's looking at those kind of questions. What actions should we try to answer that question? What data will we collect? So how do we know that we're actually in a co-design space rather than actually somebody is taking a lead, they've taken there's actually that shared ownership and understanding. I don't know, Toby, from your point of view, if you want to say anything about the co-design aspect of that.
Yeah, just the co-design will be a very familiar concept to people, and the different the way that co-design functions within a human learning systems approach is ever so slightly different, in that what is being co-designed aren't programs of work. What is being co-designed are experiments or explorations together. So whether that's a public-facing worker working with a citizen or resident, what shall we try so that your life might go different? Or whether that's a commissioner working with a group of organisations in a space, what shall we try to make these relationships different, and why? So what is being co-designed is an action learning approach. So people are designing together what question are we answering? What actions are we going to undertake to answer that question? And there's something, the rigor here comes from genuinely treating it as an experiment, and an experiment that is being co-designed, right? Because if you're running an experiment, you want data to capture. And I mean data in all senses. So it's not, I'm not just talking about simple measurement stuff. So the output of arts activities is data, right? But the key aspect of this is that people are planning what the data capture that they need to understand how that experiment is going, and they're planning who's going to come together to make sense of that data. So the co-design process is a process of designing a whole action learning approach together, basically, and ensuring that what people are doing is having the opportunity to frame together what is it that we want to learn about, and what actions will we try out to answer the questions that we set ourselves. So that co-design being, it is a design of a learning program.
Thanks, Toby. And I do feel that we're at risk of rushing here. So I suppose what I want to say is that before we're closing, if you're getting those bits right in terms of the conversations, understanding system, and the co-design, then when you're going into experimentation, I think that's actually the zone that you guys are most expert in anyway. You're constantly in that, doing things differently and testing things and learning. The key point is having the other partners, so identifying the actors that are involved, doing those bits about co-design means that when you're doing those experimentations, then you're really being able to share the learning of that and the buy-in across the whole system, and especially commissioners, given that the focus of this is about commissioning differently, being able to do that with commissioners so that they are buying into the difference it makes, because very often you do great things, the world changes for the people that you support, and a wee bit, as you said, Fiona, and then it dies. Excuse me, rather over, but it does. It's people lose. Communities lose on that. They have a good thing for a while, but they don't. So it's important in terms of experimentation that those first two bits are done, and that there's, as Toby said there, that we're then able to collect data and evidence, which is about the learning that's gathered from those experiments, rather than did they perform, but actually a learning approach in there. And then you're into that space of being able to think about embedding. And again, the embedding and influencing isn't about embedding the silver bullet, the answer. It's about embedding the learning so that you continue to do that, and that remains as a cycle. I am mindful very much that we are at time. This is a journey which is just begun. And Susan, we can now see you now. Sorry, Susan. Could you?
Yeah, listen, I really, all I can say is that the bit that I've seen, I'm really sorry that I've missed it all. And yeah, looks really good.
It's recorded, so you can always go back.
No, thank you, I will. It's because it's apt. And I also have some other people who haven't had the opportunity to come tonight that I can speak to, because, yeah. Thank you.
And there is the, as Toby shown here, there are a number of materials. This presentation will be shared as well. And Toby and I have been working, so we've been commissioning Centre for Public Impact to work alongside us, and we will be continuing to run events through the year, which we do make as open as possible, and in particular opening those out to community organisations, so they're part of the conversations as we try to think, well, how are we going to cope with some of the challenges that are ahead, not just this winter, but beyond. So, so thank you very much for everybody's time. Sorry, Susan, did you want to ask?
I was just going to say, is Audit Scotland ever invited to any of these things, or people that measure how some of the statutory's risk might be perceived?
That's a great question, Susan. That's fantastic. So have they been invited yet? No. Am I now about to go and put them on the list? We've done work, because Audit Scotland did, for example, the review of self-directed support and had a lot of pointers in this direction, to be honest with you. Yeah. So actually I can see why that would sit very well with them. That is a great shout, Susan. A good invite to add into the list, so thank you.
Sorry if that's all I could contribute.
Well, that's a great contribution. Fantastic. So thank you, Toby, for the material today and for the inspiration, and thank you to John and colleagues for setting up this opportunity. We are always keen to make those connections with the community, for everything we said about knowing that people live their best lives in and part of communities, and therefore, from my point of view,